Hi, this is LeJune with LeJune Singleton LLC, Fitness, Health, Nutrition, and Wellness Podcast. April 18th through April 24th is Infertility Week. So today I would like to welcome my guest, Dr. Vita Khaki. She is a holistic menstruational coach. She helps women with irregular periods, infertility, PCOS, and fibroids, as well as other hormone issues. Thank you for joining me today.
It is my pleasure. Thank you for having me, LeJune.
So can you give a background on yourself?
Well, do we have all day? I love talking about just my journey. I always had hormonal issues. I had adult acne that was so bad. It was so embarrassing. In college, I spent thousands of dollars on acne products just because I had that cystic hormonal acne all over my face. I was very self-conscious about it. It really, really affected my life. I also struggled with bloating. Looking like I'm pregnant. And I have a smaller body, but I had serious bloating. I struggled with mood swings, very, very painful periods that were kind of all over the place as well. And so I have had lots of sicknesses starting in my early 20s that just would go undiagnosed. And I truly believe that they're the result of these hormonal fluctuations that were causing me to get sick. And so I was actually in school to get my MD and PhD. And I was sick and I was going to a bunch of different doctors and no one could help me. All that kept coming up was, well, you're anemic, so eat more iron. And so there were no real answers for me to help me. And so that's when I then went the holistic route and I said, okay, traditional medicine is not helping me right now. So let me go look into herbs. Let me go look into alternative therapies and look more at my food. And so I was able to regulate and balance my hormones completely naturally. And so that's when I said, I'm not going to be a practicing physician. I'm just going to drop that. And then I'm going to show people how they can fix their sicknesses or hormonal irregularities naturally. And that even extended to me when I was trying to conceive my son. And I had some delays there, some very, very painful challenges. And so I was able to figure things out, go back to the playbook and all my learning. And I was able to fix my fertility issues naturally as well and conceive my beautiful son.
So the thing that many people, they go to the doctor and they find out that they have fibroids, that they are, not able to conceive. I get a lot of clients myself who struggle with PCOS, and it's never told what are the main triggers for these things. It's always pushing pills. I had a fibroid myself, a small one that I had removed, and everything was, okay, here's your options. Hysterectomy, removal of it, burning the uterus, which is new, that is still tricky. And okay, why aren't we talking about the nutritional side of what we're eating that's causing this? What are your thoughts on that?
Well, I think number one, in medical school, there's no requirement for a nutrition class. So most doctors do not even take a nutrition class. And I actually teach at multiple different universities, and I work at UT Southwestern Medical Center in Dallas. And there is no nutrition class that the doctors are training in. Okay, so of course they know, okay, your clients need to eat healthy or your patients need to eat healthy, but they don't get trained on what that actually means.
Right.
So I think that it's difficult for a doctor to really give advice on that, because if they're getting a medical degree, they're mostly trained on pharmaceutics. That's the whole point of the medical degree. It's heavy on pharmacology. It's heavy on diagnosing disease and treating it with medicine. They're not trained on herbs. They're not trained on other holistic methods. So it's not that the doctor doesn't care about you. A lot of my clients say that their doctors don't have time for them, or they're not trying to figure out the root cause. It's just because they're not trained in that. If you go to an MD, they know how to diagnose you and they know how to use medicine to treat you or to use surgery to treat you.
Right. Right.
So that's it. That's the type of doctor that you're going to.
And that definitely, makes sense because, again, you go to the doctors and most people now want to try a holistic approach because of the long-term possible effects of medicines that we're taking. And it's kind of like you're telling your doctor this, and it's a deer in the headlight syndrome of, uh, they don't really tell you what you should eat, but they'll tell you what you're not supposed to eat anymore. So do you think it should be someone working with a holistic doctor like you full time, or a combination of going to their regular primary care and working with a holistic doctor?
I just recommend people do both.
Okay.
I recommend people always go in for their physicals, go and get blood work. I can order blood work from where I'm at, but I live in Dallas, Texas, and I work with a small number of people that are here. So I work with people all over the world. So I always recommend that people go to their regular physician, but then also go to an acupuncturist, also have a holistic doctor, have a naturopath doctor, have a number of different people as part of your medical team. Don't just depend on one person. Because, even if you're diagnosed with cancer, they say, go get a second opinion.
Right.
So you need to have diversity in the people that are treating you. So have a chiropractor there, have your acupuncturist there, have a holistic doctor, have someone that you go to for herbs, have someone you go to for supplements, so that it's like a healthcare team that's working together.
And I think that's the thing with most people. They are so comfortable with their doctor and they don't want to have that new conversation with someone new of what's going on with their health, or either they're not asking questions when it comes to their health. When it comes to clients coming to you or patients coming to you, and it's, you need to know everything that's going on with their health, but maybe sometimes it's some gaps there. How do you get patients to feel comfortable to open up when it comes to that, where you're getting everything, where you are truly able to help them?
I have never had an issue with opening up.
Okay.
Maybe it's my personality, or maybe it's the fact that I actually choose who I work with. So I have a very busy calendar. So I have to speak with someone first to kind of see if I have the resources and the wherewithal to work with that particular person. So before they sign on with working with me as a patient or et cetera, we've already kind of bonded, and I've already gotten everything out. So yes, there's some people that I'll talk to and then I'm just like pulling teeth to just say like, okay, what's the problem here? Or I'll get some people that will say that are having fertility issues, but they'll say like, well, I don't really care, if I have a baby, or, things like that. Right. So in order for me to actually work with someone, it has to be a symbiotic relationship. So I need to know everything that's going on. You need to feel comfortable with me, and I need to know that I trust you enough so that we can work together.
Yeah, that makes sense. Yeah. So what are some of the causes of infertility, especially in women of color?
Yes. Diet plays a big role. Not necessarily so much so that you're eating unhealthy foods, but a lot of women underestimate the fact that they could be eating foods that they're allergic to or that they're sensitive to. That was a big one for me. And we're always changing. We're always evolving. I was doing a GI cleanse last week, and I discovered on that GI cleanse that I cannot eat cashews like that my body reacts to cashews. So, and it's like something that it's like, okay, yeah, eat healthy fats, eat this, but everybody's different. The things that I can eat for optimal health are different from the things that you can eat. And those things change all of the time. There's certain things that I can eat during the summer that are great for me that I shouldn't eat. So there's a reason why you eat seasonal fruits and vegetables, right? Because they're growing in a particular season because you're supposed to be eating them during that season. So I think people underestimate these food allergies, food sensitivities. So when we do elimination diets and things like that, I see great results. So I think number one, Eating unhealthy, definitely. Number two, eating foods that you're sensitive to. I have to add in environmental toxins. So the lotions, the cosmetics that we put on our skin, a lot of them are harmful. There are great ones out there on the market, but the majority of the ones that you just go to your big box store and buy are extremely harmful. So that's a big piece of it. Inadequate supplementation, I would say, would be the fourth one. And so the list goes on. And it depends on each person. So it depends on where you live, who you are. That's why there's no one set protocol in terms of fertility of each person. It depends. It has to be customized for everyone to figure out really what's causing this person's reproductive issues, what's causing this person's fibroids.
And that definitely makes sense. I never really, because I did some food sensitivity tests. And as you mentioned earlier, you talked about bloating. That was one of the things I noticed for me. It was bloating, it was acne, it was inflammation in my body. My hands would be like swollen, my thighs, my legs. And went to do a gym assessment. They're like, your body is over 50% of muscle. And I'm like, what are you talking about? I don't have muscle. This is all fat. But when I did the food sensitivity test, it made sense.
Right.
Because I was eating cashews, which is healthy, supposed to be healthy. Right. Almonds, healthy. Mushrooms, all these things that, is deemed healthy, but for my body, it's not healthy.
Right.
Baked chicken, grilled chicken, which, people, protein, which wasn't something that was healthy for me. And definitely, that makes sense when I looked at that and I cut everything out after I got my results. Within that week, I was down 12 pounds, and most of it was inflammation and the swelling in my body. So I noticed, when you go out, you really don't know what they're putting in the food when they say it's vegan or vegetarian. It could be cashew milk that they're using or almond, which causes bloating. So I do think, as you said, it is important to know what you're putting in your body that's causing inflammation, but most people don't want to cut it out. So what do you say to your patients who say that may do an allergy or food sensitivity or intolerance test, and they're like, oh, I'm not giving up chicken?
They don't want it bad enough. We go back to the pain. So if you're okay with never having a baby, then that's fine. If you're okay with having your serious hormonal balance, if you're okay with constantly having fibroid surgery after fibroid surgery, that's you. But if you really want to have this baby, if you really want to get rid of this fibroids, if you really want to regulate your menstrual cycle, then you have to do what you have to do. So we'll work together to find better alternatives, but it's just really how bad do you want it?
And with your patients, do you offer like food choices that they could try that can help them get healthier? What does a session with you look like for patients?
So yes, it depends. It depends on the particular situation. I have a fertility detox program. And so that one, I tell them exactly what to eat every single day over, a certain period of time. And depending on their, food preferences, food likes, they can choose like a different path. Like, if they want to eat certain types of foods, I have different things that they can choose. But yeah, I definitely have programs for women that are, for example, overweight, but they want to conceive. So I have food plans that I'll put them on. So I'm heavy on nutrition with my programs. That's the first thing that we come in and clean up, depending on, what's going on with their body.
So do you recommend supplements for your clients or patients? Because, when it comes to supplements, a lot of people will say, well, I don't eat enough of that, or I can just get it in a pill. What does that conversation look like?
So it's a tough conversation, a very, very tough conversation to have. Number one, a lot of the supplements that are on the market, we don't know their efficacy. So I know one particular company has like technology where they've tested their subjects 1 hour after taking the supplement, and then they can see actual changes in blood sugar and things like that. So I usually refer people to those types of brands where there've actually been studies that this supplement actually induces a change. So a lot of supplements that are just out there on the market, you can't assume that they work. Number one, I don't like a lot of them that are out there because they're made from synthetic ingredients. So they're like manufacturing calcium in the laboratory. And so those types of things, when you're consuming those manufactured chemicals, they come in and then they cause havoc. So I like supplementation, but I'm not the person that says go and get a one a day. So I teach my clients, especially my patients that are trying to get pregnant, to get their supplementation from herbs and natural substances.
Okay. And I agree because, I've gone into the store and I'm reading the label and it could be calcium, for instance, and it's absolutely no calcium in this calcium supplement.
Right.
And most people don't read the labels. They just grab it's calcium, it's on sale for this amount. And I think, we do need to kind of get back into trying to get our nutrients in foods.
Right.
But of course, nowadays, a lot of people don't want to, especially if you have somebody that's overweight, they're trying to, I don't want to eat a lot. I can just take a pill and drink water or do a fast throughout the day. What do you say to those patients?
My patients that are overweight or obese, a lot of them have those eating habits where they just eat twice a day. And so I just have to point out to them that you've been doing things this way and it hasn't been working. This is my track record. You see the people that I've worked with, you see the results that they've gotten. So let's try to do things my way. Just give me 3 months and we'll do things my way. If things don't work my way, then we can go back to your way. And so it's just those tough conversations that I have to have with people to show them, like, all the stuff that you've been doing isn't working. Otherwise you wouldn't have called me. Otherwise you wouldn't have reached out to me. So you have to eat. You have to eat frequently. You can't just eat twice a day and that's it. Especially if you're wanting to have a baby, if you have PCOS, if you have, if you're obese, you need to be eating frequently. Because the problem is you're waiting so long to eat, then you eat one meal, and then you wait so long to eat, then you're like, oh, I'm not going to eat. And then it's 9 p.m. and then you're like, oh, I'm hungry, let me eat. And then now you're just eating junk food at this point. Everything needs to be planned out. Plan your meals. I'm going to eat this. I'm going to eat this. I'm going to eat this. And increase the food intake. Doesn't mean you're increasing eating junk food, but eat more vegetables, eat more of those healthier foods that are going to help you, eat more fiber. So yeah, those are tough conversations I have to have, but if they're coming to me, it's because things have not been working the way that they've been doing them.
This is definitely true. So what did your services look like during the pandemic up until now? Because, people are at home, they're overeating because they're bored. I'm sure the hormone imbalancement is off the charts because, you're having Uber Eats, DoorDash, all these places delivering unhealthy meals to patients and clients. So what was those conversations like for people who may be new or people that you were pre-existing clients?
Yeah, the pandemic was hard. Even for people that had regular cycles, the pandemic threw a lot of cycles off. And so things have been really, really hard. So what I suggested for most people was to use delivery services for groceries. Mm-hmm. So use that Whole Foods Market, Amazon Fresh delivery, use your, whatever your Kroger or whatever your grocery store is. So that was key because that's a game changer. Right. Instead of like doing Uber Eats and Uber Eats, you can get, some stuff delivered, but you don't know what's in it. So that's a game changer. You can get all of your vegetables delivered. There's no excuse about, I have to go to the grocery store. No, you can get all of it delivered to your house. And look, I'll even tell you exactly what to order. I provide shopping lists. Go through, just order this. These are the recipes. This is easy. Now you're at home. You don't have to go to work. You can make all of your meals. You have an hour lunch, for example, for those that have an hour lunch, you have a whole hour lunch. You can prepare this lunch. You know, you don't have, there's more convenience with the pandemic. So I saw that a lot of people struggled with their cycles because of the pandemic, but the pandemic showed us that we actually have more resources than we thought we did.
Right. I definitely agree because, you know, you have Instacart, so many grocery delivery services that you can utilize instead of using fast food options that are unhealthier, that is going to have your hormone imbalance just off the chart. Speaking of periods, especially in African American and women of color community, a lot of women suffer from painful periods, or either they may get their period every 2 or 3 months, or either they'll have their period for the whole month. What are some of the causes of that?
I have found in our culture that the environmental toxins are the ones that are really wreaking havoc. You know, if I were to show you my inbox, like on Instagram, for example, the women that have irregular periods, a lot of them are these influencers that have the YouTube channels for makeup. I can tell you probably 75-80% of the women that come to me specifically for irregular periods have like a YouTube channel for makeup. So these are women that are putting this heavy makeup on every single day. Of course, there's some brands that are non-toxic for makeup. There's some great brands that you can use. But, you know, we like these more expensive, you know, we like our MAC makeup and they're okay every once in a while. Every once in a while, it's okay for you to, you know, wear your makeup and things like that. But this shouldn't be something that you're putting on every day. I mean, even every week, I hesitate to tell somebody to put that toxic makeup on them every day. So I think in our community, I think the environmental exposure is major. There are other things such as like EMFs, so radiation exposure from our phone, laptops, things like that. I would say that those two are big for the irregular periods. I've seen that people who take those two things seriously, once we go in and fix those two things, we start to see more relief. Of course, it doesn't completely solve the problem because you have the dietary aspect and other aspects, but those two things are important, the radiation and the toxins.
And I know some women, either before their period or while they're on their period, they have issues with chronic constipation, where they're not able to go to the bathroom during that whole week, or the week of being on their periods. So what are some of the reasons that's causing that for women?
Yeah, that's all hormonal. Mm-hmm. So that's all hormonal. They're hormones that relax muscles. So if you have cramps a lot, that means that you're having like contractions of the uterus. And so you know that your bowel area, all that, those are muscles that are contracting. So hormones completely control that. So if we can balance those hormones, we'll get rid of that. I have struggled with that. Even I've struggled with constipation outside of my period, and then it gets really bad during my period. And then I've had the opposite where I have more like diarrhea.
Oh, wow.
During my period. So I've had like both extremes. But when my hormones are balanced, then I don't have those issues. So it's just really going through and balancing the hormones without birth control, of course.
Right. And that is definitely one thing that's always suggested is birth controls, which are the side effects is weight gain and blood clots. So what are some of, not to give everything, but what are some things that women can do to help balance their hormones? Because, you know, women suffer hair growth. Some women suffer facial hair growth. Like you said, the imbalancement of bowel movement, either it's constipation or diarrhea, is the soreness of breast. After being on their period, they may still feel like they're on their period because they're still having the symptoms of the period.
One big tip that I can give is to eliminate sugar altogether. And that's looking your peanut butter. If you eat peanut butter, that's one thing I can't eat. But if you consume peanut butter, I want you to check the ingredients. So most peanut butter will have sugar in it. If you check just about anything, if you eat the yogurt that's flavored, that has sugar in it. If you are drinking anything really outside of water and, something that you make yourself, it has sugar in it. Bread. They put sugar in bread. How could you put sugar, so of course the yeast needs some sugar, but then even after the bread is made, they'll add more sugar to the bread. For me, that baffles me. You use barbecue sauce on your meat, they put sugar. I would say read labels, eliminate sugar. That does wonders, especially for women that have PCOS. Of course, every once in a while, you can have your cookie or whatever, but you'll be surprised once you start reading labels, how much sugar is in everything. So I would eliminate that right off the bat.
And as you said, reading the labels, one of my friends was looking for cranberry juice. They're adding apple juice, grape juice, all this stuff to it, and the grams of sugar was 85 grams. Okay, where's the cranberry juice? Cranberries are tart.
And imagine having a lifestyle like that from being a child. So my son is 19 months old. And so you'll see other people that have kids my age start to give their children stuff with sugar in it, crackers with sugar. A whole bunch of stuff with sugar. And so imagine having that every single day. If you look at your life, you'll see that you may be one of those people that has had sugar every single day of your life. Probably.
I know that was me. I know that was me.
You see, even in formula, there's sugar. So imagine from the day you're born, if you were formula fed, up until now, and you're a 30-something-year-old woman, and you basically had something with sugar every single day of your life. Imagine what that does for fertility. Imagine what that does for your menstrual cycle.
This is true. That's definitely something to think about because, I don't think we really, even when it goes back to medicine and supplements and things like that, that we put in our bodies over so many years and the side effects and the long-term effects of this stuff.
It's detrimental. I have women, girls, I can't even call you a woman if you're 16, 17 years old. I have girls that are 17 years old with messed up menstrual cycles. This used to be a thing where your cycle doesn't get messed up until you're 40 or 40, maybe even mid 40s. But now I have 17-year-olds that have menstrual cycles that are just out of whack. And so fertility is having a normal menstrual cycle, even if you don't even want to have children. There's some people that I work with, I have clients that never ever want a child, but they need to be fertile. We need all of your reproductive organs to work, because if your menstrual cycle is not regular, that means that there is a serious problem within your body. Your menstrual cycle tells you so much about your health. And so fertility, this is Infertility Awareness Week, but it's not, yes, it hurts those of us that have struggled to have a baby.
Right.
But there's another subset that aren't thinking about a baby right now and that may never ever want a baby, but they are infertile and you don't want that. Your whole body needs to be healthy. You need to always be fertile, whether or not you want to have children.
So, endometriosis is another huge thing in our culture that women suffer with, where they're having painful periods and the risk of not being able to have kids, and they want kids. I'm sure you get clients or patients like that. What are the conversations like with them?
So, an interesting thing that I find, I rarely get a woman that just has endometriosis. Mm-hmm. Usually she has endometriosis, she has cysts in her ovaries, she has fibroids. She has more than one thing. I can't even think of a single patient that I've ever had that just had endometriosis. So these are women that have an entire reproductive issue. Like their entire uterus needs help. And so I isolate the endometriosis. I don't even call it endometriosis. I call it your uterus is unhealthy, your cervix is unhealthy. Like you need a total makeover of your uterus. So we start from the beginning. We figure out why their uterus has these imbalances. Sometimes, and I'm a different kind of practitioner, sometimes it can be things that happened in the past, trauma.
Right.
So I've noticed with a lot of my women that have endometriosis, a lot of them have been raped. Mm-hmm. So we have to go back to what happened when you were 16? What happened when you're 17? What happened when this started? We need to heal. You need healing. So our uterus, we get love from down. That is our pleasure spot, our cervix. That is the place where we receive not just sexual pleasure, but our baby sits there. I mean, that is like the center. That is our organ. And so whenever something happens in our life that's traumatic, mm-hmm. whenever we're heartbroken, whenever we have these serious things that happen to us, I can almost trace back like when your mom left you and when you started having like these issues with your uterus. So women that have endometriosis are a special kind of woman because they need something more. They need something more than my woman that has PCOS because they have trauma. And so that they need psychological treatment. Not saying that they are like, have mental health issues, right. But they need a different type of treatment plan because they have multiple different gynecological issues going on. And so I come at it in a place of let's heal your uterus, and women get healing from it.
And I definitely agree because, I know people who have fibroids, who have cysts, who have endometriosis all at the same time, and who also experience infertility issues because of that. And that was actually, one of my next questions is, do you believe that trauma is one of the things that causes some of the issues when it comes to our hormones as a woman, when it comes to, the infertility and things in our bodies that's trapped there and we don't really realize it?
Absolutely. Whenever I have my first call, or even before someone gets on a call with me, I ask them things like, how are you feeling? I need to know the mental state that a woman is in. That is major. So you see how that's different from a woman that has irregular periods and they go to their MD, their MD's office, and then the MD says, okay, here, take the birth control.
Right.
That doesn't solve anything. For me, I want to know why you have this issue. Why is your body producing extra tissue? Why? So your body's producing extra tissue in your endometrial lining. It's producing cysts. It's producing fibroids. Why is your body producing so much of this? So I need to know the root cause. I'm not here putting a Band-Aid on. I'm not here treating symptoms. But I need to know what happened in your life. When did it start happening? So that we can get to the bottom of it. So trauma is a big part of it. Heartache. I think about me when my brother passed away. My brother died suddenly. He was completely healthy. He was my favorite person in the whole world. And when he died, that's the beginning of all of the unexplained illness that I started out this show from. Mm-hmm. That's when it started. I had a broken heart. That was a traumatic incident for me. My menstrual cycle was it took me years to figure that out, that I needed healing. Not saying that I'm ever going to get over losing him.
Right.
But that affected my reproductive organs. That affected my hormonal balance. I needed to treat and I needed healing from that. And then I was able to move on. And then even when I went to go have my son, I always in the back of my mind was like, if I were to have a son, it would be like I'm having like my brother, like, I could have like a piece of my brother. I can't wait for that like love. But there was still a little bit more healing that had to happen there. I was still a little scared about like thinking having a baby without my brother being there. And then my dad had died too. And like, there was just so much going on that I was thinking about, like the possibilities of having this baby and what it would remind me of the two men that I was closest to in my life. So I needed healing from that. That was a part of the journey. Now the diet and everything, all of it is important. The mental part is just as important as the diet as well.
I agree. I definitely say to my clients, the mindset, the nutrition is 80%. The fitness part is only 20. If you don't have your mental together of your past trauma, your past grief, your past abuse, whatever happened in your life, you can't move forward with your health journey, with your overall life, because those things are keeping you from moving forward. And even if it's not your uterus, it's some type of health pain that's in your body. If it's high cholesterol, what's causing it? If it's, a pain that you keep getting in your knee that won't go away, what trauma happened in your body that caused that?
Right.
So I definitely think you definitely touched on that, because a lot of women don't realize that your past is stored at some point or somewhere in your body. Right. And sometimes it is your uterus. And we're wondering why, because, I hear so much about endometriosis. And it's like, okay, what do you do for that? Is there a surgery for that? And there's not. They're just giving birth control for it.
Right. So sad.
It is. So when you get clients that come to you, what are some of the conversations like of how long services will last? Is there a time frame? Is there based on, when they feel that, okay, I'm pregnant, I'm done? Like, what does that look like?
So I ask, so there's some women that I can say, okay, for your situation, you can get pregnant this year. But there's some women that I have to have the realistic expectations, and I have to tell them, you've got a long road ahead of you. Your body's nowhere near ready to carry a baby. So I have everyone tell me, when do you want to get pregnant by? And so most women will put like a time frame that's maybe like 4 to 9 months out. I think after talking to me, like for a lot of them, it hits them like, okay, this is my time frame. So then we now devise a plan to help them meet their goals. Most women will get pregnant before their goals, but you have some that don't. And so some we need to extend our services. So I'm not a person that says, hey, I have a 3-month program. Hey, I have a 2-week program. There are many programs that you can take within the journey, but I don't sell like 3 months and you're pregnant type of situation. No, we're working. Usually there's a certain hormone that's off. So we're working hard to get that hormone level great. Okay, now that we got that hormone level great, let's work on other things. So I'm usually working with women until they get pregnant. But no, I do not promise you 3 months until you get pregnant. No, we're working together until your body is ready until you're in the right mental frame, emotional frame, until your body is fit and ready to conceive. And through the process, they get pregnant.
So one of the things that you definitely work on is nutrition. Do you recommend fitness? Do you, what emotional support? So what does services look like for you, for women who, are saying this and they're like, I want to have a regular period. I want to get pregnant at some point. I no longer want to deal with fibroids or PCOS or any other hormonal issues. And they see this and they're like, but I'm not sure if she can help me. What would that look like, for me to come to her?
Yeah, good question. So initially, I care about weight a lot. Oftentimes women will have stubborn weight because their hormones are imbalanced. So number one, I need you to be at a normal weight for me to work with you. That means that I have to balance your hormones so I can optimize your body's ability to lose fat, to lose weight. So I'm sure you see this where you'll have that woman that eats 1 meal a day, 2 meals a day, she's overweight, she just can't lose the weight. Well, I have certain supplements, certain herbal supplements that I'll give the woman that will help to balance their leptin levels and those levels that are important for satiety, hunger, and fat loss. So number one, I need to get you to a normal weight. And so I use herbs and things like that to get them to the normal weight, right? So once we're at the normal weight, now we need to figure out what's going on with that cycle, okay? So we need to figure out, are you ovulating? How long is the luteal phase? How long is the follicular phase? These are just the different phases of the menstrual cycle. So of course, when we're talking about fat loss, we had a specific protocol to optimize you to get to the right weight. So now we're going to put you on a fertility boosting diet. If your goal is to have a baby, great. We're trying to get you to ovulate. If your goal is just to have a regular cycle, we're trying to optimize and get your cycle to be regular. So that's when we would come in with the food. I would come in with herbs. I have herbs that help women. So we detoxify, remove all of the toxins, all of the junk from the body, so that we can come in and use these herbs and food to really treat that cycle. And then we take a step further with my women that want to conceive. Mm-hmm. So when an egg is fertilized, that process from fertilization to implantation is a delicate process. And so I have a lot of women who just have been trying for years to get pregnant, but they probably need like a thicker lining for their cervix. So I have herbal supplements that I'll give for that. I'll have things that I'll give them to make sure that the pH in the cervix is appropriate. Mm. Most women don't know this, but do you know that whenever your fertilized egg is traveling and it's being implanted, if that pH level isn't right in the cervix, then it's not going to implant. Or if you have intercourse again and there's more sperm that goes in there and messes up the pH, it's not going to implant. So the last step of my protocol is really giving those herbs to make sure that implantation happens. And then the final step would be to make sure to optimize the body to prevent miscarriage. So it's really a 4-step phase. So if you are coming in just for irregular periods, you do phase 1 and 2. But if you want to get pregnant, it's the entire 4-step process.
Okay. And do you include the women's partners when it comes to making sure that their husband or boyfriend are eating healthy when it comes to the whole process of getting pregnant?
So the meal plans and everything are him and hers. So they're included. I also do testing, sperm testing as well.
Okay.
Yeah.
That's definitely good, for people to know, because I have friends that it's a back and forth thing. It's you why I'm not getting pregnant. No, it's you why I'm not getting pregnant. And most of the time the males don't want to get tested.
Right. Yeah. Well, I take care of all. I have testing for both male and female. So so he's going to have to get with the program.
That's definitely good to know. So definitely women, if this is something that you want to check out and have your husband go, is, not going to the doctor and occasionally seeing somebody that you can do it from the comfort of your home and send it in.
Ship right to your house. So no excuses.
Right. So how do you, balance career and motherhood and personal life and self-care for yourself?
Ooh. So I try to have my child be a part of my career as much as possible. So at first, I used to try to hide the fact that I had a son. Like whenever I'd be in meetings, he had to be away, or whenever, but now, no. When I'm shooting videos, he's there. When I'm working on something, he's there. Earlier before this, I was just editing. I was filming and editing a reel that I'm going to post on Instagram, and I'm showing him. So he's a part of my career. I mean, he's the reason why I do what I do, because of the challenges that I had to have him. So when I'm working on something, he's only 19 months old, but I show him like, hey, look at mommy. When I have a YouTube video that's posted, I put the YouTube up and I show him. He's in my videos. He's on my Instagram. So I incorporate my son into my business. And so even at that small young age, he knows my theme song for YouTube. He knows, he knows what, he kind of has an idea of what mommy does. So that's the best way that I found to really juggle it, is to bring him along on my journey with work, and to be there with him. I don't spend long gaps of time away from him. When I'm working, I'm with him. And then so that's the thing that I found works best for me. I grew up in a household where my mom was always working. She would be gone for most of the time. I don't have a whole lot of memories of my mother when I was young. But my dad, he had a business. And so he would take me to his business, and he would take me he did like tiling and things like that. He had a tile company. He would take me to his projects. Like, I was part of his business. He would ask me to calculate stuff for him. And so that's what I'm trying to do with my son and my husband. If I have a business trip, I'll take them both with me. So I bring them along into my business, and I make sure that they're a part of that business.
I definitely think with kids remember the trips that you take, the time that was spent, opposed to the million toys and the video games and things like that. That matters most, because it makes them feel loved, and it makes them feel like, oh, they cared enough to incorporate that time for me and not just work. So yeah. I commend you on that, because your son is saying, mommy's doing this and I want to do YouTube too when I turn 2.
Right. So, right. Yeah.
So I think that's definitely important. So what's coming up for you? I know you told me you have a book. Can you kind of tell me about it?
Yes. I am launching a book during Fertility Awareness Week, and it's called Women's Health Guide. And so in this book, you will find things that you can do for 5 minutes a day to boost energy, balance your hormones, and to live a better life. A lot of people come to me and they say, hey, I want to live like a healthier lifestyle. I want to balance my hormones, but I just don't have time to research things. I don't have time to like sit on these special expensive mats. I don't have time to go to acupuncture, for example. So in this book, it's really a quick start guide. Just things you can do for 5 minutes a day, things you can eat, herbs you can use, detoxing, things that you can do, things you can remove from your life, that just take a few minutes a day. And so if you just do those small little things add up to a whole lot for your health. So it's really for that busy mom, that busy working mom, that busy student that needs to make those small changes to see results in their life. So I'm launching that during Infertility Awareness Week. I'm also relaunching my new website and new blog as well. And so that blog is going to have everything for women's health, whatever you need for period health, whatever you want to know, for just what do-it-yourself recipes for skincare, do-it-yourself recipes for laundry detergent. I mean, you name it. So it's just going to have a lot of resources for women to check out.
Okay. And where can people find your book?
So people can find my book. It will be on Amazon. So you can get it in the Kindle store, and then you can also buy it on paperback as well.
Okay. And
it will be on audible.com. So if you're an audiobook person as well, you can find it. Yeah. You're into audiobooks too, huh?
Yes. Audible works so great when you're on the go and you can just listen to it in your car, on your lunch break, whatever. So whoever came up with that, I commend you, because it works great.
Yeah.
And where can people find you for services?
Sure. The best place is my Instagram. So my Instagram is at Dr. Vita K. So DrVitak. TikTok is pretty cool. If you want to get some good laughs in, you can catch me on TikTok. If you're trying to get pregnant, I do have a free Facebook group that you can join. It's called Supplements to Enhance Fertility. And so you can find me there, or just whatever social media you like the most. I'm on YouTube, Facebook, Clubhouse. I'm everywhere. So you can find me there.
And final words, what would you advise, recommend, or suggest for women who are suffering with all the things that we've listed: infertility, irregular periods, hormone imbalancement, endometriosis, fibroids. We know the list goes on, and there's probably some new stuff out there we're unaware of. What would you recommend to those women?
There are always going to be harsh treatments for everything, especially in women's health. There's always going to be the option to have surgery to remove the cyst, to remove the fibroid, to remove the tissue from endometriosis. But I urge you to take the natural route first. I've been able to resolve many, many gynecological issues naturally. So I urge you to first go that route, because once you learn that, it's a lifelong skill. You will always know how to keep your fibroids at a small size, or to even shrink them. I've been able to shrink fibroids naturally. So you'll always know how to do that. Once you learn it for your unique body, you can keep that for the rest of your life. Whereas if you go have surgery to remove the fibroid, you're just going to have more fibroids that are going to grow, and then you're just going to have to keep having surgery. So try things out naturally, because once you learn things naturally, that's a lifelong skill that you'll always have.
I agree, because I've had friends that's had multiple fibroids removed, end up getting hysterectomies, and didn't have a kid. So, it's women that don't want that option. So I definitely thank you so much for what you do, because you are helping so many women in our culture and outside our culture who suffer from all these uterus issues. But they're afraid to say anything or afraid to seek help. And when they see someone like you that's saying, you don't have to have a hysterectomy, you don't have to do birth control, you don't have to, have a hysterectomy or any other invasive surgeries, that's very healing to hear for me as, a woman, that, okay, there's other issues that, can be dealt with outside of my uterus. So I thank you for what you do.
My pleasure.
Thank you for your time. And again, can you tell us, when the book comes out? Because we want everybody to get it. The week of the 18th and the 24th of April. Please go check her book out, because I'm going to get it myself. So please, can you tell us one more time?
April 23rd is the date when that launches. So you can go get that on Amazon and well, I think Amazon will be the best place at first. I think it delays a few days for it to be on Audible.
Right. Okay. And again, I'm Lejeune. So definitely, if you're suffering from any form of hormonal imbalancement issues, uterus problems, pain, please, Dr. Vita or anyone else in a holistic realm, work with your doctor to get these things corrected, because we're not supposed to live with pain. And that's something that we've been told for many years. It's supposed to be painful. It's not. So thank you again.
Thank you for having me.